and HBO's two-part series, One South, Portrait of a Psych Unit, gives viewers unprecedented access to a psychiatric unit in New York City treating college-age patients. Take a look right here.
Would it be fair to say that you've been thinking about suicide relatively frequently?
I think I was ruminating on having a plan and acting on it for a really long time.
We have like a situation. Okay.
I think we need more people.
So here to give us more information on the story behind this project is filmmaker Lindsey Megrue, and also joining us is Dr. Laura Braider from Northwell Health and AVP College Mental Health. So good morning to both of you. Thanks for taking the time.
Good morning.
Such an important conversation to have, really, and to see what happens behind the scenes. So Lindsey, what drew you and your co-director, Alexandra Shiva, to do this project?
Well, we realized, you can't open a newspaper, I think, today and not see stories about there being a mental health crisis, particularly among young people. And so we really wanted to look at what does that mean from a intimate, on-the-ground, firsthand perspective. And we quickly realized in our research that inpatient care in particular is still the least understood and probably most stigmatized. So we wanted to focus on that area in particular. And then we found this program at Northwell's Zucker Hillside Hospital that was just very unique. It's one of the only units in the country that specializes in treating young people and particularly college students. So we're really excited about the program.
Yeah, Dr. Braider, let's talk to you about that, right? And kind of why you are the only one when mental health is, or one of the only ones when mental health is so prevalent, especially in the youth. And you're kind of leading the way here. Tell us a little bit about the unit and why it was formed.
Sure. Well, I think we are all aware that there's a mental health crisis on college campuses, and there's a large population of college students that are suffering. There's a smaller part that is in need of emergency or acute care. And our patients that we focus on are in psychiatric crisis, need hospitalization or post-acute care. And I think that what we realized is that college students sort of fall between the cracks. There's a situation where they're not adults, they're not children, but they're out on their own and they have autonomy. And so that can be a recipe for a disaster. Yeah. So when people are in need of immediate psychiatric attention, there's 96 schools that send us their students.
Wow.
That are either suicidal, homicidal, or psychotic. And when they're assessed, they are put on this unit with other college students. And I'm very grateful to Northwell for allowing us to build this, because a lot of hospital systems are not going into this direction.
Right.
So when you're in the trenches working on this project, was there anything that surprised you that you learned?
There were a lot of surprises. I think one thing that's really important is just how the skills that we were witnessing patients learn are actually skills that all of us can use.
Yeah.
Like this film is really something for a broad audience. There's no one who can't benefit from learning mindfulness or learning about radical acceptance. So I was really surprised at the broad appeal. I was also struck by how dedicated the team of providers is and what they do together to take care of themselves so that they can take care of their patients.
Yeah, and meeting them at the level that they're at, right? Because part of the, and I'm not the expert, you are, but I can imagine part of the struggle is getting them there in the first place to admit that they may be having some kind of mental health issue.
Absolutely.
And opening up because of the stigma around it.
Absolutely. And I think one of the reasons we did this film was that when we see students on the inpatient unit and they look around and they see other students that are experiencing this sadness or anxiety or whatever they're going through, it's so normalizing and comforting to have peers there that we thought, what if we could generalize this out so that other people that are viewing and your viewers can see that there's other people that might feel this way and that there's help to be had, and that we are very good at treating people, but we need to get to them.
Yeah, I was just going to say, probably leaves a lot of folks feeling hope after watching the project.
Yes, we hope the film will convey a sense of hope and will also encourage help seeking.
Good. Well, thank you both for coming in today. Thank you for making the film and what you do to take care of the youth. They are the future.